Dizzy people of the internet, I'm the Dizzy Doctor, Dr. Cameron Daniels. Great to be here for another training. Today we'll be talking about the 5 most common myths about vertigo and what the science actually says about it. For those of you that don't know, my name is Dr. Cameron Daniels. I specialize in upper cervical chiropractic. Upper cervical just means upper neck, where I focus on neurological integrity of the upper 2 bones in the neck to restore neurological function, increase communication from brain to body. I take care of vertigo specifically, while I take care of other conditions as well. But vertigo, I have a special place in my heart for it, so I like to be able to produce content for all of the dizzy people out there as the Dizzy Doc. If you like this content, please consider subscribing. Also consider liking this video. Helps push the algorithm towards people that need it. And who knows, it might be your like that gets to the person that needs it. So let's go ahead and read this beautiful quote by Jim Rohn, a self-help specialist, actually. Take care of your body. It's the only place that you have to live. So beautiful quote. Very, very true. I see it all the time in the clinic. We should take care of our bodies because in taking care of our bodies, it provides us with a long-term sustainable relief to be able to live our life beyond expectations. Quick disclaimer before we get started. This content is for educational purposes only. It's not a substitute for medical advice. Always consult a qualified healthcare provider regarding any symptoms or conditions that you're experiencing. And if you experience sudden or severe dizziness, seek immediate medical attention. Let's go ahead and get started. Quick overview. We're going to be going over multiple different topics. Number 1, the difference between vertigo and other kinds of dizziness. Number 2, why vertigo isn't always caused by the inner ear. Number 3, why short episodes still matter. Number 4, why tests like MRIs actually help and when they don't. What you can do safely at home to start taking control is number 5. Let's go ahead and get started. Number 1, vertigo is not just dizziness. Most people, even clinicians, use the word vertigo to mean any type of dizziness that people are experiencing. And this would make sense, right? But hear me out. Vertigo has a very specific definition. Vertigo, by definition, is a false sensation of movement. Often, characterized as spinning. The world is spinning. I feel like I'm on a boat swaying. I feel like the world is tilted. I feel like I'm on stilts. Very, very common presentations of vertigo, or when you're honestly just not, you're just not aware of your surroundings at all. So think of it like a GPS losing its satellite connection. Your inner ears, your eye, your brain, all of this are supposed to work in tandem with each other and telling you where you are in space at any given moment. And when one of these systems sends mixed signals, the brain interprets this as motion, even when there isn't any. And this mismatch is what we call vertigo. So in contrast, what people experience is lightheadedness that feels like faintness, often from low blood pressure or dehydration. Disequilibrium feels like imbalance when walking. Presyncope is a sense that you might pass out. Why does this matter? This matters because the type of dizziness that someone's experiencing can tell the clinician where the problem is coming from, whether it be your inner ear, your brain, cardiovascular system, or something else entirely. I'm very, very big into research. I love research. I like to be able to provide people with research. So in these trainings, you will find research-backed data, not just what Dr. Cam is saying from clinical experience, but from also what we find across the medical field as well. So the American Family Physician Journal repeatedly emphasizes its distinction in their diagnostic approach, found in the research quoted there. Number 2, vertigo isn't always an inner ear problem. One of the most common myths that I hear in the clinic is that it must be my ear crystals again. This is sometimes true, but BPPV, benign paroxysm, or benign, I always mess this up. I'm human too. Benign paroxysmal positional vertigo is indeed one of the most frequent causes, and it's not the only one. Vertigo can actually come from the brain itself. This is exactly what I see, particularly areas that process balance and motion. Central causes include the following: a vestibular migraine. This is where the balance centers are very hypersensitive even without a headache. Another common thing that I see in the clinic is people with headache, migraine. Oftentimes these two can be associated, but sometimes they might not. So that's what I'm talking about here. Cerebellar or brainstem stroke. This is rare, but it's critical to rule out because if this is the case, this is pretty much an emergency room referral. We want to get this patient taken care of as soon as possible. And then number 3, multiple sclerosis. Okay, this can disrupt nerve signals in the vestibular pathways. MS is another debilitating disease where essentially these myelin sheaths inside of your central nervous system, okay? These myelin sheaths are essentially these little fat pads that are supposed to send signals into your body. They start to demyelinate or kind of start corroding. almost like a corroded wire. And so this is what we see in patients with multiple sclerosis. And this disruption of nerve signals can, influence the vestibular pathways as well. So we need to rule these things out. It's not always the inner ear. Again, it could be coming from the brain. These central types often look different. The vertigo might be constant rather than episodic, accompanied by neurological symptoms like double vision, weakness, or even difficulty speaking. The key takeaway is this. If your symptoms do not fit the pattern of a typical peripheral ear problem or inner ear problem, or if they come with any neurological red flags, a deeper evaluation is warranted. A lot of people with dizziness, vertigo think that, this will pass, this will go away. While this is true, if your body's experiencing something, it's because we need to get it taken care of. It's a fire alarm going off inside of your body that we need to get checked out. So evidence of this, Gurley and Edlow, seminars in neurology highlight how distinguishing between peripheral and central vertigo is vital for an accurate diagnosis. Keyword, accurate diagnosis. We don't want to throw any pills, potions, or lotions at you. We want to start more conservative and work our way towards the more the more invasive approaches. So number 3, short episodes still matter. Many people assume that if an episode of vertigo only lasts a few seconds, that it can't be serious. But in reality, the duration of the symptoms tell us exactly what type of vertigo it is. Hear that again. Many people assume that if an episode of vertigo only lasts a few seconds, it can't be serious. But in reality, the duration of symptoms tell us exactly what type of vertigo it is. BPPV, for example, typically causes vertigo that lasts seconds to a minute, brief, triggered by head movement, and not associated with hearing loss. That's because it's mechanical. Tiny calcium particles in the inner ear canals shift when you change position. On the other hand, Meniere's disease causes vertigo lasting 20 minutes to several hours, usually with hearing loss or ear fullness. Vestibular neuritis is another form of vertigo that can cause days of spinning that worsens with movement. This is a very debilitating condition, vestibular neuritis. And these are actually very complicated cases to take care of here in the clinic. However, they're very fun to take care of because, again, when you have vertigo, your world is spinning, and it's debilitating. I mean, patients they can't even function. I mean, it's a debilitating condition. So, but vestibular neuritis has this place of honestly probably one of the worst conditions to experience within your life. So, when you tell your provider how long your dizziness lasts, you're not just describing your discomfort. You're actually giving them a roadmap for a diagnosis, and we're finding this with research from all around. But all this research comes to both underscore how episode length and triggers are actually diagnostic gold for providers. So make sure that you're telling your provider this. Number 4, you don't always need an MRI. Dizziness often feels alarming, and that fear can push people to demand scans and lab tests, but most vertigo cases, especially BPPV, can be diagnosed through a simple bedside exam. One of the most powerful diagnostic tools is the Dix-Hallpike maneuver, where the patient lies back quickly with their head on one side, and a specific pattern of eye movement called nystagmus confirms the diagnosis. It's fast, it's inexpensive, and it's highly, highly accurate. Imaging is reserved for specific cases, sudden hearing loss, new neurological deficits, or risk factors for stroke. See, if your vertigo comes with slurred speech, weakness, or double vision, yes, we need imaging. We need an imaging. But if it's classic, positional, and repeatable, tests add pretty much little to no value. You'll be wasting your money on an MRI at that point. So, and there's research that confirms this as well. Let's see here. You can help yourself at home. Here's the most empowering myth to be able to dispel, that vertigo must always be treated by someone else. In fact, for BPPV, the most common form, self-treatment, can be just as effective. Sometimes you don't need to go through, even a care plan with me, or even, doctor's visits over and over and over again, or go to the neurologist. Honestly, a lot of this stuff can just be treated at home. Again, let's start more conservative before we go to a more invasive approach. I've known people who've had, invasive ear surgeries to remove these crestals, and it's just, let's start more conservative. That's actually why I'm starting to post videos now, is because I want people to be able to have information. I want people to be able to, have information on this, be able to know exactly what's going on, have the research, be able to understand their diagnosis better. That way, honestly, if I can help you avoid one doctor visit or one misdiagnosis, then I've done my job. So, a 2023 JAMA Neurology studied followed patients performing self-guided Epley maneuvers at home. And the results were remarkable. Symptom resolution was nearly identical to those treated in clinics. And some people charge a lot of money to do Epley maneuver. I'm not going to get on that high horse, but with the right guidance and follow-up, you can often manage recurrent BPPV episodes safely. That said, proper instruction is essential. So if you're able to do like a virtual visit, for example, with me, if you're able to do a virtual visit, I'd be able to walk you through this and exactly how to do it, just as a step. Let's just see if it works, right? Doing the maneuver incorrectly can worsen symptoms or target the wrong canal. So always confirm your diagnosis with a professional first, then learn the correct technique for your specific ear. And again, there's research that shows this. So before we leave, I just want to make sure that we have key takeaways, okay? Key takeaway number 1, vertigo is a distinct type of dizziness caused by false motion perception. Key takeaway number 2, not all vertigo starts in the ear. Brain causes exist too. Number 3, episode lengths are diagnostic, or episode length and triggers are diagnostic clues, not, to help either rule in or rule out. Number 4, MRIs are often unnecessary for clear positional vertigo. And then number 5, evidence-based self-care like home Epley maneuvers can be both safe and effective for the client or patient. Closing reframe, the most dangerous myth isn't about the ear or the brain. The most dangerous myth is the belief that vertigo means that you're broken. I want you to hear this. You are not your diagnosis. It's not in your head. You are not your diagnosis. This is not, you are not vertigo. Vertigo is your brain's alarm system simply trying to make sense of all these mixed signals that are coming in. And once you understand those signals, you can begin to calm, your mind and calm them as well. So knowledge brings control and control brings peace. You don't have to fear the spin. You just have to understand it. So what are some key takeaways for you all to be able to take home and start implementing? Number 1, track your symptoms, right? Note timing, duration, triggers, and associated features. Again, all of this just adds up for you to be able to provide your provider or give to your provider and help them better understand your condition. This is not the doctor's condition. This is your condition. You are not the doctor's patient. You are not the doctor's patient. The patient, or you are what I typically tell my patients. I'll just say what I typically tell my patients. I tell my patients, you are not my patient. I am your doctor. You are paying me. This clinic is ran off of patients. So what I mean by that is you are hiring me to be your doctor. So this is your case. The more stuff you have for your case helps in the long run. Number 2, perform slow, steady breathing. It calms the autonomic system and steadies perception. Number 3, ask your provider about BPV. If positional changes trigger spinning, request a Dick's Halpike test. Number 4, learn guided Epley maneuvers. With professional confirmation, these can be very useful for recurrences that happen in vertigo. Number 5, stay observant, not afraid. Awareness is your first tool towards balance. That's it, my friends. Again, I'm Dr. Cameron Daniels. I hope that you enjoyed this video. If you like this video, that would be a huge, huge help. I mean, I don't know who this is going to help. I don't even know if this is going to reach anyone. If you could like this video, subscribe, do all of that. That just would bless me so much, and it may bless someone else too. If you know someone suffering from vertigo, please send them this video. Send them this video and just tell them to watch it. I hope that you all have a great day. I hope that this blesses you, and I'll see you on the next training.